Hello, everyone, and welcome to the pre-application webinar for the Transformative Research to Address Health Disparities and Advance Health Equity. We have a mailbox posted on the initial slide here. If you have any technical difficulties, please send an email to this address. Please also note that this webinar is being recorded. We will be posting the recording of the webinar as well as the webinar slides on our website approximately 1 week after this event. We will also be sending out a notification to our listserv when that information is posted. So if you have any, if you have not signed up for the listserv, please be sure to do that so you can be notified when the materials are posted. I'd like to go ahead and get started. If we could advance the slide. Okay, great. So we'll just start today with a few webinar instructions. All participants are muted. We ask that participants save your questions for the end. NIH staff will be addressing the questions that we received to our mailbox in advance first. If time allows, then the participants on the webinar may use the question and answer box to submit questions. Please do keep in mind that scientific inquiries and ideas for individual research projects will not be discussed during this webinar. So this shows you how to submit questions via the Q&A panel at the end of the webinar. Please make sure that you select all panelists. Then you can type in your question into the box and then hit the send button. Please do not use the chat box for Q&A. Questions that are sent to the chat box may be missed or overlooked because the NIH staff are monitoring the Q&A box. So please make sure you're entering your question in the right box. Next slide. Oh, great. So I'd like to introduce some folks that will be helping us, are helping out with this initiative, and also many of whom are on the webinar today. So I will begin by introducing Dr. Janine Clayton, the Director of the Office of Research on Women's Health in the Office of the Director. Janine can't be here for the first part of this webinar, but we hope that she will be joining us for the later part. And so with that, I'm not sure if our other co-chairs have been made panelists so they can unmute themselves, but if you can, Dr. Mike Sayer, could you unmute yourself and introduce yourself?
Stephanie, give me 1 second. Let me unmute him.
Okay, thank you. Well, while we're waiting for folks to be unmuted, I see that Dr. Shannon Zank has been made a panelist, and I think, Shannon, you can unmute yourself to introduce yourself.
Hi, absolutely. I'm Shannon Zank, Director of the National Institute of Nursing Research. Good morning, everyone.
I think that maybe it's a little bit difficult to get the other folks unmuted. So I'll take the liberty of introducing some of our other leadership. Dr. Michael Sayer, who is at the National Institute on Minority Health and Health Disparities. Dr. David Wilson, the Director of the Tribal Health Research Office in the Office of the Director. Also, Dr. Elizabeth Wilder, who is the Director of the Office of Strategic Coordination that oversees the NIH Common Fund here in the Office of the Director. Next slide. Great. And we have on this slide some members of our working group that are involved in the webinar today. Allison, could you introduce yourself?
Good morning, everyone. I'm Allison Brown and serve as one of the coordinators, and welcome to today's webinar.
Nate?
Good morning, everyone. I'm Nathan Stinson. I'm the Director of the Division of Community Health and Population Science at the National Institute on Minority Health Disparities.
And I'm Stephanie Cushane-Schlink. I'm a Senior Advisor with the NIH Common Fund in the Office of the Director. April?
Good morning, everyone. I'm April O, and I'm a Senior Advisor for Implementation Science and Health Equity at the National Cancer Institute.
Great. Next slide. We also have staff with us from the grants management and review portions of NIH that are helping with this initiative. Aruna?
Hello, can you hear me?
We can.
Yes, we can.
Good morning, everyone. My name is Aruna Behera, and I'm the Scientific Review Officer at Center for Scientific Review at NIH.
Shalonda?
Good morning, everyone. Shalonda Bynum, and I am also at the Center for Scientific Review. And with the Aruna, we will be managing the review of these FOAs.
Dee Dee?
Good morning, everyone. I'm Dee Dee Rupberg. I am the Chief Grants Management Officer at the National Institute of Dental and Craniofacial Research, and I'm serving in the capacity of the Grant Management Officer for this initiative.
So our agenda for today, we will first be going through an overview of the NIH Common Fund. Then we'll go into an overview of the Transformative Research to address health disparities and advance health equity initiative, which are consist of the two FOAs that we will be talking about today. We'll go into some details about cooperative agreements and specifically the U01 mechanism that is used for these awards. We'll then go through the review process and the review criteria, and then we will have our Q&A portion. So first, to share some information with everyone about what the NIH Common Fund is. The NIH Common Fund is a component of the NIH that supports a set of trans-NIH scientific programs. Common Fund programs foster innovative ideas with the potential for transformative impact, and they are intended to benefit the broad biomedical research community. The Common Fund and Common Fund programs are funded by the Office of the Director and are managed in partnership with the NIH institutes and centers. The Common Fund helps to move the NIH mission forward faster, and we do this by supporting bold scientific programs that aim to catalyze discovery across all biomedical and behavioral research. Common Fund programs advance areas of biomedical and behavioral research that are important to the missions of multiple NIH institutes and centers. So our programs don't focus on one organ system or one disease, but instead are generally relevant to the missions of many NIH institutes and centers. And Common Fund programs spur subsequent biomedical advances that otherwise would not be possible without an initial strategic investment by the Common Fund. And so with that, I'll turn it over to Dr. Shannon Zank to talk a little bit about the background for this initiative.
Thanks, Stephanie. Another initiative of NIH is called UNITE. Its goal is to end structural racism and racial inequities throughout the biomedical research enterprise. We know that part of ending racial inequities in biomedical research is ensuring that NIH-supported research benefits the health of all populations, but especially those whose health is negatively impacted by racism. As a result, an important goal of UNITE is to conduct new research into health disparities, minority health, and health equity. A new Common Fund initiative, which we're talking about today, grew out of UNITE, and its mission is to support big, bold ideas and science with the promise of transformative impact and ultimately eliminating health inequities. Next slide. Today, we're excited to share information about 2 funding opportunity announcements as part of the Transformative Research to Address Health Disparities and Advance Health Equity initiative. The purposes are to develop, implement, and/or disseminate innovative interventions and strategies to prevent, reduce, or eliminate health disparities and health inequities. And then second, to increase the competitiveness of investigators and expand the research base dedicated to health disparities research at minority serving institutions. And I'll turn it over to my next colleague.
Hi, everyone. So as Dr. Zink has shared, there are 2 funding announcements, and I'll go over the eligibility for these. For the first announcement, RFA-RM-21-021, this is open to all institutions or organizations that are typically allowed to apply for NIH awards, but unfortunately, it does not include NIH intramural investigators. The second funding announcement is RFA-RM-21-022, and this RFA is specifically for minority serving institutions. Eligibility requirements include first, the institution must award undergraduate degrees and/or graduate degrees in biomedical sciences. Second, at the time of application, the institution must have received no more than $6 million per year in total costs from NIH research project grants in each of the preceding 2 fiscal years, calculated using the NIH reporter. And third, enroll at least 25% of undergraduate students supported by Pell Grants based on the most recent 2 years of data available from the Integrated Post-Secondary Education Data System database. This is maintained by the National Center for Education Statistics, or are an accredited medical health professional school with a historical mission statement that explicitly states that it was founded to educate students from nationally underrepresented backgrounds. You can see the notice RM-21026 for requested institutional information. Next slide, please. Multi-PI applications are allowed for both funding announcements. For RFA-RM-21-022, all PIs or PDs on a multi-PI application must be from eligible institutions. And for RFA-RM-21-022, collaborations with a non-eligible institution are allowed on an application from an eligible institution, but the majority of the research should be directed by the PI of the awardee that's eligible within the institution. And now I will pass it to my colleague for the next slide.
Thanks. I just want to go over some of the scientific requirements of the funding opportunity announcements. First, all the projects must include an intervention component. It can be development or testing of a novel intervention, it could be new implementation or dissemination strategies for evidence-based interventions, or a novel examination of programs, policy interventions that provide some innovative insight into their effectiveness. As was mentioned earlier, all projects must be transformative. Projects should reflect ideas substantially different from mainstream concepts and have a high potential to lead to major improvements in health. All projects must also focus on one or more NIH designated populations that experience health disparities in the United States. The current designated populations are African Americans, Hispanics, American Indians, Alaska Natives, Asian Americans, Native Hawaiians, and Pacific Islanders. socioeconomically disadvantaged populations, underserved rural populations, and sexual and gender minorities. So all the projects must focus on one or more of those populations. Also, all projects must document or demonstrate meaningful collaboration and partnerships with local community engaged leaders or organizations that represent the communities or populations that are the focus of the research projects. This list is not exhaustive. Please read the RFA carefully for specific additional requirements and instructions. Next slide. Also, there are some areas that are not required, but are certainly encouraged. One is community prioritized research questions. You know, what are the health conditions and topics most important to the communities that will be involved in the project? Also, utilization or focus on cross-cutting issues such as social determinants of health across sectors is an area that we are certainly encouraging. And also priority areas of the research that are within the domains of multiple NIH institutes or centers is also of interest. Multi-level interventions that address 2 or more levels of influence of health and behavioral outcomes, is a very, very strong interest of ours. Interventions that go beyond the level of just the individual is an area that we know is being recognized as more and more important in dealing and addressing health disparities. And transdisciplinary and intersectorial collaborations in sectors such as transportation, housing, the food system are also an area that we are encouraging when applicants are thinking about their project to be inclusive of those particular areas. Again, as mentioned before, this list here is illustrative. It's not exhaustive. Please, read the funding opportunity carefully for any other areas and topics that are to be encouraged. So let me pass it on to my other colleague.
Thank you, Nate. For this part of the presentation, I will cover key aspects of the application process, research strategy considerations, and lastly, the budget. For the application, it uses a standard research application form, but with a few key distinctions that we want to bring to your attention. For the specific aims page, we ask that instead of listing specific objectives of the project, that you use a one-page summary of the project and why it is well aligned with the RFA. The specific aim should have 2 separate sections, including the significance, innovation, and impact, and lastly, the insights and rationale for your study. There are also a few distinctions to note for the research strategy section. Unlike the typical R application, applicants should not use this section to provide preliminary data and experimental details. Instead, this section should be used to address why the research study is programmatically important to this RFA. It should also include the elements listed here: the research project overview and importance, the approach the study takes, including a description of the underlying logic of the study design to ensure scientific rigor. It should include why the project is innovative, the appropriateness and relevance to this RFA, and lastly, the timeline and timing outlining the transformative impact within the stated project period, key decision points, and then possible alternative strategies. Next slide. So next, I'll share more details on the research strategy considerations. A key recommendation is to make sure your proposal makes it easy to understand the innovative nature of your project and potential for transformative impact. While reviewers will have expertise in areas such as health disparities, health equity, social determinants of health, and/or intervention studies, they may not have all the expertise in the specific disease, condition, or health concern your proposal addresses. So make sure your proposal is very clear. Related, you also want to make sure you're clear about what you are proposing to do. Even though no detailed experimental plan is required, reviewers must clearly understand your research strategy. Also, when preparing your application, you want to convince reviewers that you have thought deeply about the project and have considered a risk strategy and how risk will be mitigated and what alternative approaches you will take. You also want to demonstrate that your research strategy is robust and scientifically rigorous, and that your study design is appropriate for the intervention. Given the relevance of this work to health disparity populations, you want to ensure that the study design is culturally relevant and appropriate for the context. You also want to make sure that findings can be translated into sustainable change that promotes health equity. Lastly, you want to include a clear description of the collaboration and partnerships with community organizations and/or leadership in the community that will strengthen your study. Next slide. So in terms of the budget, applicants should note that the application's budgets are not limited, but large budgets must be well justified. Requested budgets must reflect the actual needs of the proposed project. The RFA is meant to be flexible to ensure that the researchers have an adequate budget necessary for the study design proposed. There is no requirement or expectation to have a large budget, but you do want to ensure that your budget is based on your research and scientific needs. Also, applicants are required to have detailed non-modular budgets for direct cost requests over $250,000 in any given year. Also important to note is that prior approval for this notice and for this RFA is not required before submitting a budget exceeding $500,000 in annual direct costs. And lastly, the maximum project period is 5 years for both RFAs. So next, I will turn it over to my colleague, Didi Rutberg, to discuss other aspects of this RFA.
Thank you. So these two RFAs, these two FOAs will utilize a cooperative agreement UO1 mechanism. A cooperative agreement is used when there will be substantial federal scientific or programmatic involvement. Substantial involvement means that after award, NIH scientific or program staff will assist, guide, coordinate, or participate in project activities. The NIH purpose is to support and stimulate the awards activity. It is not to assume direction, prime responsibility, or adopt a dominant role. Next slide, please. This is a sample of terms and conditions of award that would be in a notice of grant award. Please see section 6.2 in the RFAs for the complete list of terms and conditions of awards that might apply to your award. For PIs or PDs, provide specific leadership for all aspects of the study, finalize study design milestones, including a robust statistical plan for analysis with NIH staff by November 30th, 2021. Provide summaries of progress towards goals and milestones. Milestones will be reviewed at least annually. Negotiate new milestones as appropriate while working with NIH staff. The project scientists will consult with the PI/PDs regarding study design milestones prior to finalizing study designs as needed thereafter. Provide scientific and programmatic support, for example, input on experimental clinical approaches, study protocols, data analysis, and others. Review the progress of the study. The project scientist will not make decisions about the funding of the project. Program official. He or she will review activities to ensure objectives are being met and NIH guidelines are followed and complied with. Have the option to withhold support if technical performance requirements and/or milestones are not met. And he or she will conduct special reviews of the project as the program official deems necessary. I will now pass it over to my review colleagues.
So now I will go over the review process. So once the applications are received, they will be reviewed in 2 stages. The first stage is peer review. So NIH Center for Scientific Review will convene a special emphasis panel to review these applications. So you do not need to provide recommended study section assignments. Applications for both these RFAs will be reviewed separately, and the special emphasis panel will take place in later part of the July. We highly recommend that you, if you could, please identify 3 to 4 broad expertise areas in your application, either in the cover letter or in the assignment request form while submitting your application. In addition, we also highly recommend, if possible, please submit a letter of intent, which is due by tomorrow, so that we know who all are applying. All applications will be reviewed by us experts in the field, and they will be providing a score. All applications will receive a written critique, but only those applications which are deemed to have highest scientific and technical merit will be discussed and assigned an overall impact score. All summary statements will be provided sometimes later in the August. And once the applications are received, the scientific review officers will contact you and will provide you the exact dates of the meeting and when you would expect your summary statements and all of the details. Next slide, please. The RFAs include special review criteria. So I highly recommend please read the section 5 of the application review information very carefully. Some of the important points I'll capture here. Reviewers will emphasize the conceptual framework, the level of innovation, and the potential to scientifically advance our knowledge and understanding. Reviewers also will look for potential for transformative impact. So preliminary data is not required. However, if preliminary data is there, the reviewers will look into those. Reviewers will evaluate the applications based on 5 scored review criteria, which are significance, investigators, innovation, approach, and environment. And based on those 5 scored review criteria, they will be providing a score in a scale of 1 to 9, 1 being the best. Next slide, please. And now I will go over these 5 score review criteria a little more in detail, especially the points which are specific to this RFA. So when evaluating significance, you need to address, does the study have a clear transformative potential? Is the prior research that serves as the key support for the proposed project rigorous? Does the project address issues related to sustainability and implications for implementing and disseminating the interventions to the health disparity populations? Next. Coming to investigators, because of the unique nature of conducting research in population experiencing health disparities and inequities, research productivity not only will be reflected by research publications, but can include contributions to public health, such as dissemination of findings to community partners, community outcomes of previous research, and efforts to build relationship and trust with community leaders. Coming to innovation, you need to address, does the application provide novel or innovative insights into improving health of one or more populations experiencing health disparities? Now coming to approach, you need to address, have the investigators included plans to address weaknesses in the rigor of the prior research? Have the investigators presented strategy to ensure robust and unbiased approach in the study design? Have the investigators presented adequate plans to include relevant biological variables in the study design if vertebrate animals and human subjects are involved? And last but not the least is, does the research use a community engagement approach or cultural constructs that reflect the desires of community and engage the community in research design and conduct? Coming to environment, does the project provide evidence of community engagement and support as appropriate? And will the scientific environment where the project will be conducted contribute to probability of success? So these are the factors which reviewers will take into consideration while evaluating the application. Next slide, please. Now, after the first step of review is done, which is the peer review, then the second stage level of review will be conducted by the NIH Council of Councils. NIH will consider several factors in making the funding decision, some of which are, the first is the scientific and technical merit, which is evaluated by the peer review, then availability of funds and relevance of the proposed science to the program priorities. Some of them will be the potential for the research to result in scientific breakthroughs of high significance and in the health disparity populations, unusually cross-cutting science, scientific balance in the portfolio of research supported by the transformative research to address health disparities and advance health equity initiative. And the earliest start date for both these awards will be in September 2021. Now I'll pass over to my colleague.
Okay, so we've completed our scheduled slides and we're ready for the question and answer period. As a reminder, NIH staff will be answering the questions that were submitted in advance first. And if time allows, we will answer questions submitted in the Q&A box. We do have a rather large crowd for this webinar, so I don't anticipate we will be able to get through all of our questions today. So if your question is not answered during the webinar, please send it to our mailbox and we'll have an NIH staff member respond to your inquiry. Please also remember that scientific inquiries and plans for individual research projects will not be addressed. So starting with the questions we received in advance, one question is, how do I know if my idea is a good fit for these RFAs? Can NIH staff tell me if my idea is a good fit? So as a first step, potential applicants should read the RFA carefully to ensure their project meets all of the requirements that are described. For example, the project must include an intervention component, and this intervention must aim to prevent, reduce, or eliminate health disparities and/or inequities. The projects may address any disease, condition, or health-related topic with demonstrated disparities or inequities, and must focus on one or more of the NIH-designated populations as listed in the RFAs. So applicants should also carefully consider the transformative and innovative nature of what they are proposing. So would the project, if successful, lead to a major improvement in health through the development, implementation, and/or dissemination of interventions to address health disparities? Is the project truly innovative? Does it reflect ideas different from mainstream concepts? Is there a high degree of novelty in the hypothesis or methodology? The applicants must demonstrate to reviewers why their project is transformative and innovative, and ensure that the reviewers understand their vision and the potential impact of the project. NIH staff can provide information on the scope and intent of the RFAs, but ultimately it is up to the applicants to decide whether their project is a good fit based on the scope and intent. And NIH staff cannot provide comments on specific ideas or plans for individual research applications, as the external review will evaluate the merit of the applications. So another question we've received is, how are these awards different from more typical or traditional NIH awards like an R01? So one major difference is the focus on the potential for transformative impact rather than preliminary data or detailed experimental plans. The special application instructions and reviewer criteria that we've gone through today have been designed to focus the applicants' and reviewers' attention more on innovation and transformative potential and less on feasibility. So other differences include the fact that the application budgets are not limited, but should instead reflect the actual needs of the project. As we mentioned before, please do keep in mind that exceptionally large budgets should be extremely well justified. Another difference is that these awards are cooperative agreements. We went through the details of the cooperative agreement and the U01 mechanism earlier in the webinar, and please do read those portions of the RFA carefully to understand how cooperative agreements are a little bit different. So we encourage the potential applicants to read all of the RFAs, including the application instructions and review criteria, to help make it clear how these RFAs are different from traditional NIH awards. And this will also help applicants think through how to develop and frame their application to ensure it addresses the unique characteristics of this particular RFA. We received several questions related to the topic of eligibility for the RFA for minority serving institutions. And we can generalize these questions as asking, if I'm a researcher at an institution that is not eligible for the minority serving institutions RFA, but which is unlikely to be competitive for the other RFA that's open to a wide range of institutions, are there any situations in which I could apply to the RFA for minority serving institutions? For example, could I partner with other institutions or organizations that are eligible? So for the Minority Serving Institutions RFA, the applicant organization must meet the eligibility criteria. So the applicant organization can partner with non-eligible institutions as collaborators if that's scientifically justified. In the case of a multi-PI application that involves PIs from different institutions, please do keep in mind that all PIs must be from eligible institutions. Also, as we mentioned before, there was a notice that was issued related to this RFA that requests additional institutional information that will help NIH verify eligibility. This notice is linked in the Minority Serving Institutions RFA near the top. If you can provide that information with your application, it would be very helpful to NIH. It is not required, so it's just a request. We've also received a number of questions about the budget, so I'll talk about some of those. One question is, the awards are multi-year funded, with the first 2 years of funding dispersed in fiscal year 21 and then annually thereafter. So does this mean the research plan for the first 2 years should be different than the remaining years? Are the first 2 years considered a pilot phase? So there's no requirement that the first 2 years of the award be different than the remaining years. There's no required planning or pilot phase in terms of the science that's being proposed. However, if a pilot phase is necessary for a particular research project, that would be allowed if it's scientifically justified. Another question we have is, please confirm if the intended $24 million total commitment represents the full multi-year sum available for these awards, or the amount allocated for first year budgets, or the amount allocated for the first disbursement, which are the first 2 years budgets. When averaging the commitment amount across the estimated number of awards, these 3 scenarios yield very different average grant sizes. So just to clarify, the $24 million is the total commitment, that's total costs, in fiscal year 21 across both RFAs. And since the first 2 years of awards are dispersed in FY21, that means the 24 million will cover the first 2 years of the awards. And also a comment regarding the anticipated number of awards, which are about 10 per RFA. This is really our best estimate, but the number of awards may vary depending on the size of the most meritorious applications. So we've gotten a lot of questions asking if PIs should calculate the budget that NIH is looking for by dividing up the total amount by the number of awards, but that approach could be a little bit misleading. We anticipate that the budgets for each award could actually vary quite significantly, and so each applicant is really encouraged, instead of thinking about what is the budget that NIH is looking for, think about the budget. Think about developing a budget that is based on the actual needs of your project. Okay, another question regarding preliminary data. Proposals aren't required to have preliminary data, and the transformative or innovative nature of the project may mean that the research doesn't work out the way we planned. So what happens if that is the case? Should we have contingency plans? So I just would like to draw your attention to some of the special instructions in the research strategy plan request. They request that applicants summarize what they believe to be the major challenges or scientific risks in the project and alternate approaches that may need to be pursued. The RFAs also state that possible alternative paths that may be followed at critical junctures in the project plan should be indicated on the timeline portion as well. I am interested in proposing a project that centers on an intervention for one of the health disparities populations listed in the funding opportunity. Is it acceptable for the project to focus on a specific population for which the intervention would have significant impact, or does the funding opportunity require a broad impact across populations? That's a great question. So the RFAs require a focus on one or more of the designated health disparities populations. Focusing only on one population with the potential for significant impact is within scope. So one or more either is acceptable. I've also seen a few comments or a few questions related to the health disparities populations. I'm going to I'll state the question and I'll ask if one of my colleagues from the National Institute on Minority Health and Health Disparities Institute might want to answer this one. And the question is whether included within the definition of health disparities populations are populations or people with disabilities. If one of my NIMHD colleagues can comment on that, would that be included within this description?
This is Nathan. I'll go ahead and answer that question. Currently, at the present time, individuals with disabilities are not an NIH designated health population with health disparities. We do know that there are individuals that are members of those populations that have disabilities. So if your project was inclusive of the individuals that are currently designated by NIH, then that would be acceptable. But if your project is just focused on individuals with disabilities itself, they would not meet the eligibility criteria for being a NIH designated population with health disparities.
Thank you so much, Nate. The question about PI eligibility and competitiveness. Please confirm if applicant PIs will be assessed according to typical NIH RFA criteria, such as having a PhD, prior NIH award track record, or if there are different criteria and considerations for this RFA. So we do have some specialized review criteria for the investigator in these RFAs. We went over that a little bit in the presentation earlier, but just to reiterate, these can be found in section Roman numeral 5 of the RFA, and the following items are unique for the investigator criteria for this RFA. So because of the unique nature of conducting research in populations experiencing health disparities and inequities, research productivity may not be reflected by research publications, but can include contributions to public health, such as dissemination of findings to community partners, community outcomes of previous research, and efforts to build relationships and trust with community leaders. So the reviewers will have those specialized criteria when they're providing scores for the investigator. Another question is on the intervention requirement. Please clarify if the invited category of research innovation stated as novel examination of program and policy interventions satisfies the requirement that each project is required to include an intervention component. It is not clear if the applicant must propose to deliver or implement an intervention versus research to evaluate an ongoing intervention carried out by other parties. That's a good question. Yes, projects can include any of the following: development and testing of a novel intervention, new implementation and or dissemination strategies for evidence-based interventions, and or novel examination of program and policy interventions designed to address health disparities and advance health equity that provide innovative insight into their effectiveness. So any of those satisfies the requirement to include an intervention component. We've received a few questions related to reviewers that I will read and then ask my review colleagues to address. So one question is, how will you ensure that reviewers understand and adhere to the review criteria? And also, how will you ensure that reviewers are familiarized and knowledgeable of the needs, experiences, and realities of underserved communities?
Okay, those are very good questions. So I will take question 1 first. So how will we ensure that reviewers understand and adhere to review criteria? So we know that the review community might be more familiar with seeing applications of the scale include preliminary data and may more heavily focus on the experimental design as a driver of overall impact. So we have a lot of experience reviewing special initiatives. So steps that we will take include conducting a reviewer training where we outline the specific review criteria for these FOAs. Once critiques are submitted, we will monitor those critiques to ensure that all of the comments align with review criteria. If they do not, we will ask for a revision of the critique and recalibration of the specific criterion score and overall impact score. So at the meeting, we will monitor, of course, discussions in real time. So if there are discussions that are misaligned with the review criteria as set forth in the FOAs, we will redirect such discussions. And more broadly, we will redirect discussion to overall impact. So there are always going to be aspects of an application that a reviewer thinks could have been done differently or better. So the focus here at the meeting will be on overall impact. So we will try to steer the panel in that direction. So I say again to pay attention to section 5 of the FOAs, because those are the criteria in which your application will be assessed based on scientific merit. Lastly, the applications are not going to be clustered with other types of applications such as R1s. So it will be easier for the reviewers to stay consistent in their framing of discussion for the applications. So the second question, how will we ensure that reviewers are familiar and knowledgeable about the needs of underserved communities? So we understand the value of diverse perspectives, especially for initiatives like these and for all applications that come into CSR. So a way of ensuring that these realities are understood is to have a diverse set of reviewers at the meeting, so diverse perspectives in the room. So this would be striving for a panel that's racially and ethnically diverse. Also, in terms of geography, we know that addressing health inequities in the North might be very different than in the South. Scientifically, of course, and those with experiences working with these underserved populations and subpopulations. Lastly, also in terms of academic institutions, so including those reviewers from minority serving institutions on the panel, so those from historically Black universities and also Hispanic serving institutions. So we believe that these measures will enhance the overall quality of peer review of these applications and allow way for diverse perspectives to be heard in the room.
Great, thank you so much. One question we've received, would a 7-year study be considered? No, the maximum project period for each of these RFAs is 5 years. Another question, does the idea of taking risks to achieve big impact reasonably include working across sites that have not directly collaborated in the past? So projects can propose working across sites that have not collaborated in the past. Whether this alone would satisfy the intent of the RFA to support potentially scientifically risky projects to achieve big impact is really something the reviewers will assess. So applicants should clearly convey why what they are proposing is truly innovative and has the potential for transformative impact. So it would be, again, that the applicant would be the one to kind of put forth the logic and rationale of why working across such sites would be considered, have the potential to achieve big impact. Is there a strong preference for single versus multi-site applications? No, the applicants should propose a robust research strategy that makes sense for their individual project and the community or communities that they are trying to reach, whether that takes place at a single site or multiple sites. It really just needs to fit the needs of the individual project. Let's see, this Question, can funding be requested for community or vendor partnerships that are currently to be determined, as they would be identified in part by data and insights generated during a prep or pre-test phase? Yes, partnerships that are to be determined can be described in the proposal, but please keep in mind that since the reviewers will not be able to judge the strengths or robustness of the specific partnerships to be implemented, the applicants should instead provide a strong rationale and justification for how these partnerships will be determined and what the purpose of the partnerships will be. This will help the reviewers to understand that the applicants have thought deeply about the project and have a plan in place to ensure robust partnerships. PIs will also need to obtain written approval from NIH for any substantive changes to the project or changes in the key personnel that are identified in the notice of grant award. So that's just something to keep in mind if part of your project is to be determined. Does this funding mechanism allow for a co-PI? So just to clarify some terms, NIH does not officially recognize the term co-PI as a role, although it's frequently used. So in NIH terms, the term multi-PI refers to more than one PI on a single application or award. Each PI in a multi-PI project has the designation of being a PI with the associated roles and responsibilities. More information on the NIH's multi-PI policies can be found on the NIH website. Just searching for multi-PI policy should pull up that information. And both of these RFAs do allow for multi-PI applications. So another term to describe is the term co-investigator. So a co-investigator refers to someone who works with the PI in the scientific development or execution of a project. So this person is a collaborator and is typically considered senior or key personnel. A co-investigator is not the same as a PI or a multi-PI. And having a co-investigator does not imply multiple PIs on the award. We have some questions around what are the allowable costs for interventions, what things can be included within an intervention component. So the first question is, please clarify if funds may be expended on the delivery of the intervention being tested or studied. Please further clarify if there is a recommended benchmark for what percentage of the requested budget may or shall be spent on delivery of the intervention versus the research costs. So funds may be used to deliver the intervention being tested if that is a necessary part of doing the project and is scientifically justified. There's no specific benchmark for the percentage to be spent on intervention versus research costs, but applicants should propose adequate budgets for the needs of their project and ensure that the amounts for the intervention versus research costs are well justified. We have a question about, can funds be allocated to a training component? So if the training component is scientifically justified, for example, if it is needed for the development or implementation of the intervention, that would be allowable. Applicants should keep in mind that the goal of the RFAs and ensure that the training is directly relevant to the intent of the RFAs. An application that proposes a training component with the goal of diversifying the workforce, but with no intervention that directly addresses health disparities would not be considered responsive. Can I allocate funds in the budget to pay for service provision that is part of the intervention being studied, given that these services are not already provided by the agency that I want to partner with? Yes, service provision that is part of the intervention being studied and is scientifically justified would be allowed. So some questions related to the UO1 mechanism. So this is a UO1 mechanism with substantial involvement from NIH staff. How should I coordinate with NIH staff to prepare my application? And there's no requirement to coordinate with NIH staff when preparing the application. NIH staff involvement in a cooperative agreement primarily happens post-award. However, all applicants should carefully read the terms and conditions of award in section Roman numeral 6.2 of the RFA to be sure they understand and are willing to accept these terms and conditions in the event they receive an award. So we went over some of the highlights of those, but please do read the entire terms and conditions that are part of the RFAs. We've had actually quite a few questions about the assignments of the NIH program officer and project scientist for these awards, and generally how that process will happen and who will those folks be. So the program officer will be from the NIH Common Fund. For project scientists, we will work with the Trans NIH working group that is managing this initiative to identify project scientists from the most relevant NIH institute or center. These project scientists may be from the working group or may be other institute and center colleagues with relevant expertise. We've also had questions related to the relationship of NIDCR, our Dental and Craniofacial Research Institute. They are listed on the FOA as administering these awards, and so folks had questions about that. NIDCR is administering the awards on behalf of the Common Fund, but the project scientists will not necessarily come from NIDCR, and the proposed research topics do not need to be directly relevant to the mission of NIDCR. Okay, we have a large number of questions that have come in through our Q&A box, so we'll be taking those. Please do also keep in mind to put your questions in the Q&A box rather than the chat box. So we've gotten, I think, a number of questions about the recording of this webinar and the slides. So just to reiterate, we are recording the webinar, and this recording will be, and the slides will be posted on the website for this initiative within approximately 1 week post a webinar. And we will also be sending a message to our listserv that will announce when these webinar materials are available. Okay.
Stephanie,
Yes.
It's Danielle. We got a couple of questions about letters of intent. I don't know if you want to touch bases on that.
Oh, fantastic. Yes, I've got a lot of questions in front of me. So the letters of intent are due tomorrow. They are not required. They are requested. It does help NIH plan the review. And so if you can send those in by tomorrow, that would be very helpful for us. And the information that's included is fairly minimal, and that's outlined in the RFAs. Does that cover all the letters of intent questions, Danielle?
Yeah, it was just about timeline and things. Thanks.
Oh, perfect. Okay, thank you. Okay. Some of the questions, let's see. There are overall budget allocations. Oops, sorry, the Q&A box is moving around. Sorry, let me find the question I was reading. There are overall budget allocations noted for the program, but is there a guide for approximate range of budget that is expected for the first year and the overall 4 to 5 years? So that's something we covered a little bit earlier, that since there is no budget cap, applicants really should create a tailored budget that meets the needs of their program. There is an overall budget for the initiative, but we expect that the budgets for the individual projects will vary widely depending on the needs of the individual projects. Okay. Looking to make sure I don't miss any questions. Should the innovation and appropriateness for the transformative research to address health disparities and advance health equity follow or precede the approach? Is the order presented in the RFA the order requested? Yes, so you will see in the RFA specific instructions in the research strategy and specific aims section please follow the order that's outlined there. Follow the instructions for those, for putting together your research proposal for those sections. How should we go about budgeting given that a specific project is not projected? Provide ideas that are subject to the monitoring of progress indicators. Should the budget represent years 1 and 2 only or the full amount requested? So just to clarify, even though we are not requesting detailed experimental plans, we do require a specific project to be described. So the details might be a little different than a traditional award, but we do want a complete project, the logic and rationale of what you want to do, and make it clear how you will go about doing this project that should be described. The budget submitted should represent all years of the project. We also had some questions about, that we mentioned that there are providing a request to provide alternate plans if things don't work out according to, the original plan, and how should we account for those alternate plans in the budget. And so our recommendation is to, when you're creating your budget, to create it based on the project plan that is your best thinking about how the project will proceed, knowing that there might be alternative paths that need to be pursued, and err on the side of not underestimating the budget, because it might be more difficult in the future if plans change and the changed plans require a significantly larger budget that will likely be more difficult to accommodate. Can you describe an example of a grant funded via a cooperative agreement and the ways in which the investigators and NIH staff collaborated? What might we expect in terms of how the project officer for funded projects might be assigned? What expertise and background might they have relevant to the projects proposed? So those are great questions, and really the ways in which the investigators and NIH staff will collaborate are spelled out in the terms and conditions of award in the FOA. So that's a good source to understand how that interaction will happen. In terms of how the project officer and the project scientist will be assigned, we will be having an assignment for the program officer from the NIH Common Fund, with expertise in the relevant areas for this funding opportunity, and then the project scientists from the NIH institutes and centers will have scientific expertise in the specific project being proposed. So just as an example, if a project were looking at an intervention to address health disparities in diabetes, the likely project scientist to be assigned would be somebody with expertise in health disparities as it relates to diabetes. So we'll try to match up that scientific expertise to get the best possible collaboration. So what information represents description of transformative impact within the project period? So that's a great question. There's a part of the RFA that states that the envisioned transformative impact should take place within the project period. So these projects should not envision transformative impact that might only be possible after 10 or 15 years and subsequent add-on funding. These projects really should aim to have transformative impact within the time frame of this project period, within the 5 years. And so applicants should outline what they think the potential major impact on health disparities would be within the 5 years of the project, and how they will measure that impact to understand if the intervention is effective. So another question is, you state focus on disparity-sensitive populations, but can research participants be predominantly white? Consider predominantly white-controlled institutions. So I will take a stab at this, and then if my NIMHD colleagues have anything to add, I believe that the interventions need to address the populations experiencing health disparities as listed in the funding opportunity. However, if that is an intervention that focuses, that the intervention itself is targeting a white controlled institution, but by targeting that institution, there would be impacts on addressing health disparities in the populations that are listed in the funding opportunity, and those impacts would be measured in those populations, that I think could be considered within scope. Does anyone from NIMHD want to speak to that?
Hi, this is Nathan. Yes, that is correct. And I just want to also give a reminder to everyone that the NIH designated health disparities populations not only includes the racial and ethnic minorities in the country, but they also include underserved rural populations, also include financially disadvantaged populations. They also include sexual and gender, minorities. And so if we really look at the spectrum, of individuals that experience health disparities, it crosses all of the racial and ethnic lines. The key is that it really needs to be, focused on improving the health or closing the gap in the NIH designated, health disparities populations.
Thank you, Nate. That was very helpful. Let's see. Here's a question. If there are 4 specific aims, each with their own budgets and clearly defined missions, and the study section or the special emphasis panel likes 3 of the 4, would they have the latitude to cut the weak aim and fund the other 3 aims? So I will turn that question over to our review colleagues, might be in the best position to answer that.
Stephanie, can you repeat the question?
Oh, absolutely. If there are 4 specific aims, or I guess these applications don't have specific aims per se, but let's say if there are 4 distinct activities, each with their own budgets and clearly defined missions, and the study section likes 3 of the 4, would they have the latitude to cut the weak aim and fund the other 3 aims?
Yeah, so the scientific review does not take into consideration funding, so that will be the Common Fund and program. So the application, when it comes in to the review panel, will be reviewed in whole. So they're not going to review 3 of the 4 aims. They're going to review the application as submitted and identify the strengths and weaknesses based on the submission, and assign, of course, a criterion and overall impact scores based on that. So program will then decide. That will be a decision in program if they like the application, or the Common Fund if the application is well received in that way that they can adjust the aims to fit the priorities of the UNITE initiative. But scientific review focuses on assessment of scientific merit based on what is submitted to the panel.
Thank you. I do not see a requirement for a cover letter in the RFA. Is it required? So if you'll note in the instructions for application submission, there are a number of different components that are required. One, underneath the section on the cover, the instructions are that all instructions in the SF424 application guide must be followed. So for all of those different components that are listed in the application submission section, most of those reference back to this application guide. So please make sure that you follow the instructions in the application guide where noted. And then for some of the sections, we've included additional instructions to take into consideration. So please look at those carefully to make sure you're addressing the requirements for each of those sections. Is it acceptable for a researcher to be listed as a PI on 2 proposals submitted from 2 different institutions? And I believe the answer to that is yes, as long as the proposals are not proposing overlapping science. So they must be distinct. Scientific projects. But if grants management or review has any comments on that, if you want to verify that statement.
Yeah, so from the review perspective, I agree that applications can be submitted by a same PI, but yes, there should be a distinction between what's being proposed for each application.
And from the grants management side, in addition to distinct scientific scope, you want to make sure resources are distinct as well.
Thank you. Will ESI be considered for this RFA?
Yeah, so I can answer that. So the NIH considers R1s only in terms of new investigator status. So there will not be any clustering of what would typically be a new investigator for these application pools because they're not R1. So the only distinction for new investigator, according to the NIH, is for R01 applications.
Let's see. Scrolling down to find our next question. In the eligibility section, it mentioned that the institution must, quote, award undergraduate degrees. We are a healthcare system. Does this mean that we will not be able to participate? So those eligibility criteria are, I believe, reflective of the FOA or the RFA for minority serving institutions. So that is RFA-RM-21-022. But the companion RFA, RFA-RM-21-021, that's the same in terms of the science. The only difference is the eligibility criteria, and that one has a much more expanded eligibility criteria that includes not just academic institutions, but a wide range of institutions. So if you're not eligible for the minority serving institutions RFA, please do look at the other companion RFA that ends in 021 that is much more expansive. Let's see. Can the project involve an international component? Does the PI have to have strong disparities research? So for both RFAs, foreign institutions and non-domestic components of US organizations are not eligible to apply, but foreign components are allowed. In terms of whether or not the PI has to have a strong disparity research background, applicants will need to look at the criteria for investigators in the RFA and judge whether the PI has the necessary qualifications to be able to conduct the research and fare well in peer review. Researchers might also consider if their own background is maybe lacking in some areas that are important for conducting this research, forming partnerships or collaborations so that the expertise across the team is well balanced. That might be one way of addressing any potential gaps in an individual's record. Let's see. You mentioned that the Common Fund does not focus on one specific disease. Is the assumption of this RFA that applications will cover multiple health issues? Or, for example, could one apply to address the many facets of cancer, multi-level and transdisciplinary? That's a great question. So while Common Fund programs themselves do not focus on a specific disease or condition, individual awards within an initiative may focus on a specific disease. So there's no requirement in this RFA that proposals include multiple diseases and conditions. Although if that's an area of interest, that's certainly welcome, but you can also focus on an individual disease or condition that demonstrates health disparities. Will this mechanism be reissued after this cycle? The NIH may reissue these RFAs in the future, depending on scientific need and availability of funds, but that is a maybe, so it's not clear. Is an external biostatistician required on this project? There's not a specific requirement for that, but if your project would benefit from that and is really needed in order to put together a strong proposal, then that would be something that the applicants should consider when they're putting together their project team. Let's see. We anticipate, oh, sorry, the questions and answers just jumped around on me. We anticipate a non-academic entity to be a key participant in the proposal. They do not have a Commons ID. Can they be included? And for that, I will actually ask, maybe our review and grants management folks can address how potential collaborators without a Commons ID may be included, either as a collaborator, or do they need a Commons ID if they will receive funds, for example? How would that work?
So I will defer to grants management on that question.
Yeah, I'm confirming the policy as we type this, just to make sure I'm clear on it. I think they need to have a Commons ID, but I want to confirm. So if you can go on to the next question and I'll get back to you.
Absolutely. Let's see. A question about a specific population that would count as a health disparities population, specifically a Middle Eastern, North African population, many of whom are refugees. Would this population count as a health disparities population? Maybe NIMHC would be able to speak to that.
Could you repeat the question again? I'm sorry, I missed part of it.
Oh, no problem. This question was about working with a specific population, mainly of refugees from North Africa and the Middle East, and would that be considered a health disparities population?
Currently, they are not designated as an NIH population that experience health disparities in the U.S.
Stephanie, this is Betsy. Good morning, everyone. This is Betsy Wilder. I was introduced earlier, the director of the Common Fund. I did want to clarify one issue about the reissuing of these FOAs. Although what Stephanie said is absolutely correct, it's not a definite because it really all depends upon the availability of funds. We do expect to reissue the FOA, at least to MSIs, recognizing the length of time required to apply is pretty short here. So we're hoping to be able to do that. I just wanted to clarify that that is a priority for us, assuming that we have the funds available.
Thank you, Betsy. One question here. Researchers engaged in laboratory research may not be able to engage. Oh, hold on. The question just moved as I was reading it. Let's see. Researchers engaged in laboratory research may not be able to engage community leaders. How do we get our hands around this challenge? So that is a challenge, and I think that, you know, since the community engagement is such a strong part of this RFA, this is where the partnerships really come in handy. So, you know, if a laboratory researcher doesn't have those collaborations and partnerships, figuring out a way to put those in place and coming up with a project that would work with community organizations, work with those partners, strengthen the proposal, work together to develop community and culturally, contextually appropriate interventions really is a pretty key aspect of this. So it would be up to the applicant to bridge those connections, to foster those connections, and to put together the proposal.
Stephanie, I have an answer on the Commons registration and ID.
Oh, yes, thank you.
So let me read from the policy, from the grant policy statement. Any individuals with an undergraduate, graduate student, and/or postdoc role who participate in NIH-funded project for at least one person month or more should be registered in the Commons and should verify that all personal information located within the Personnel Profile tab in the URI Commons is accurate. This is required regardless of whether salary is actually charged to the project or not.
Great, thank you, Dee Dee. Okay, let me find my next question. Can you please elaborate on the eligibility requirement of institutions receiving NIH grant ceiling of $6 million for the institution? So this is only for the RFA focused on minority serving institutions. And correct, so one of the criteria is that at the time of application, the institution will have received no more than $6 million per year in total costs from NIH research project grants in each of the preceding 2 fiscal years. We've provided a link in the RFA of the NIH reporter, which is how you can use that to calculate your institution's NIH research project grant support. You should also note that not every NIH award is considered a research project grant. So when you're calculating that amount to see how much your institution has received, please make sure you're only focusing on NIH research project grants, or RPGs. And as a reminder, if an institution does not meet that criteria for RFA-RM-21-022, the companion RFA, the one that ends in 021, is really open to most entities. So if you miss the eligibility criteria on the RFA for minority serving institutions, please do consider applying for the other RFA because it is the same science. Let me see, I'm looking for, sorry, I'm looking for our next question, which ones, we're parsing through which ones can be, have already been answered. So what are the eligibility criteria to apply for UO1? Is a bachelor degree in biological sciences one of the criteria? So since the applications are actually submitted by the institutions, the eligibility criteria for the institutions are what are described in the RFAs. So in terms of the eligible individuals, what the RFAs say is that any individual with the skills, knowledge, and resources necessary to carry out the proposed research as the PI or program director are invited to work with his or her organization to develop an application for support. So since the applications come from the institutions, as far as the criteria for the principal investigators, that is up to the institution to decide who is eligible within their institution. Just wanted to pause there and see if grants management or review folks have anything to add to that, or anything you'd like to say differently.
Yeah, so from the review perspective, I would say make sure that the expertise of the PI aligns with the specific focus of the application. So again, as Stephanie said, if the PI does not have, it's lacking in specific expertise, make sure the key personnel has all of the expertise collectively to ensure that the application, if funded, would be successful.
Yes, Stephanie, I have nothing to add. I ditto what you and Shalonda have said.
Thank you. So question, please define intervention. We are considering an intervention at the hospital level, not individual patients. Also, does the application have to include research? What if the project evaluates the hospital level intervention? That's correct. An intervention could take place at the level of the hospital. In fact, we strongly encourage multi-level interventions that don't only target individuals' behavior. The intervention can happen at multiple levels. Let me go back to the question. It's jumped away from me here to make sure I address everything that was asked. Does the application have to include research? What if the project evaluates the hospital level intervention? So in this case, I would say, the research is evaluating the effectiveness of the intervention. So is your intervention having a significant impact on changing or addressing health disparities and inequities, as measured by relevant markers for whatever your intervention is addressing. And so that really is the research component is doing the research to assess whether this intervention is having the effects on the populations it is targeting. Sorry, I'm trying to pull up the next question here. So one question is about companies. 501c3s and LLCs would be eligible to apply for the RFA, not the one targeting minority serving institutions, but the one ending in 021. Yes, and so for those nonprofits with 501c3 status, as well as for-profit organizations, are eligible to apply. So I'd encourage everyone to look at those eligibility criteria, eligible institutions that are listed in the RFA for a complete list, but those are included. Let me see, I'm finding the next question. Some of these have been answered already. Can applications be focused on children or pediatric populations? So the answer to that would be yes, provided that those populations were also part of the populations experiencing health disparities that are listed in the funding opportunity announcement. So for example, if the intervention were targeting a pediatric population of African American children, that would be included because the African American is one of the populations that are listed in the funding opportunity. How many applications can come from one organization per RFA? I believe there's no cap on the number of applications per institution, provided those applications are scientifically distinct. Let me know from grants or review if you think differently. That's my understanding.
I agree.
Excellent, thank you.
Agree.
Fantastic, thank you. I'm just looking for the next question. Thank you. Traditionally, NIH has multiple application deadlines of their funding throughout the year. Will this funding have another deadline of applications this year? So for these particular RFAs, there's only one funding deadline. However, as Betsy mentioned earlier, we're really strongly hoping to be able to reissue an additional RFA for the minority serving institutions again in the future. But for these ones right now, there's only one application deadline. let's see, I'm looking for some questions that haven't been addressed. Just bear with me here. Everyone can probably hear the grandfather clock in the background reminding us of the time. Oh, here's a great one. Is there a strong preference? Oh, I lost it again. Hold on. Hopefully these can stay still for a minute. Let's see. I think the question, so I'm having trouble finding the question again because it moved around, but I think the gist of the question was, is there a strong preference for randomized control trials, or are there other study designs that are appropriate? And that's a very good question. There are many different rigorous study designs that are appropriate for these RFAs. Depending on the unique needs of the population and of the intervention being studied, randomized control trials might not fit all situations. And so in the RFAs, we've outlined a number of different models for rigorous study designs. Those or other designs that are scientifically justified and rigorous are welcome. You do need to make sure that the design that you choose is justified and makes scientific sense and is a rigorous design for your study. Okay, we've gotten a lot of questions about the letters of intent. So just to clarify for everyone, the description of what the letter of intent needs to include is in the RFAs. There's a part of section Roman numeral 4 describing the letter of intent that is due tomorrow. There's not a large amount of information that needs to be provided. It is not required. If you can submit that, that would help us plan the review. So we would appreciate it, but it is not required. So everyone, please do look at those RFAs to find the information about the letters of intent. Let's see. Looking for another through our questions here. So some of these questions have been addressed. Let me keep looking. So this is a question that's actually come up in a couple different contexts. I understand there must be an intervention involved. Can the intervention be formative, i.e., sorry, my questions moved again. Developed through a well-described process to ensure the most contextually and culturally appropriate interventions. So we have received a number of questions about, you know, I would like to do an intervention, but the first part of this project is going to be to work with my community partners to develop that intervention. So we don't have a clear picture of exactly what the intervention is now. Is that okay? And in that case, I would say, you know, we definitely recognize the need to work with community partners to ensure that interventions are contextually appropriate and are likely to be taken up and implemented by the community. That's an important issue for sustainability and for impact. And so I think in that case, it would be helpful to describe in your proposal a clear view of what this intervention would aim to do. You know, what do you ultimately hope this intervention will accomplish, and the process by which you would go about developing this intervention. How will you engage the community? What are the sorts of things you're going to take into account? What is your process for developing this intervention? And so that will help demonstrate to reviewers that you've thought deeply about the project, that you are taking the necessary steps to ensure that your intervention is robust and is culturally appropriate, and help give a clear picture of, even if you don't know what the intervention itself will be, what impact you hope this intervention, what impact you expect this intervention to have in the future. This is a great question, and I actually will, maybe Dee could help out with this question. Are there restrictions on the start date? Could the proposed start date, could the folks start in fiscal year 2022? Now I know that we need to disperse funds in fiscal year 2021, but is there any way that projects could start later?
No, they'd have to start later than like probably mid-September of 2021.
Yep, of 2021. Thank you. Question about what about resubmissions? Are we allowed to resubmit addressing the grant reviews? So resubmissions are, I believe, are not allowed for these RFAs. This is a sort of a one-time, one-time receipt date. So there will not be resubmissions for this RFA. I should also note that for these RFAs, no late applications will be accepted. So this is a great question. I'm not really understanding the sort of tension between saying a detailed research design is not required, but also asking for a strong defense of research design rigor and appropriateness. And I think that's a great question. A number of people have commented on that. If I'm not providing a lot of details, how are reviewers going to be convinced that what I'm doing is rigorous as it's required? So really what we are looking for is, in lieu of preliminary data or detailed experimental plans, providing the logic and rationale for pursuing the project in the manner proposed. The reviewers do, even though there's not the same level of detail as in typical NIH applications, the reviewers still need to be clear on what you are proposing to do. They need to be clear that you've thought deeply about the project, the potential challenges, some alternates you might need to take, and they should be satisfied that the research will be conducted in a robust, rigorous, and reproducible manner. So keeping that in mind, how would you convince the reviewers that what you are doing is rigorous? Thinking through that will help, I think, shape your application and how you frame it. Let's see. My intervention will focus on an intervention that may include some undocumented students. Will funding be permitted for minority populations that are undocumented? So I think maybe NIMHD folks, and also maybe that's a grants management issue in terms of what funding is allowed. Would anybody like to take that?
We don't ask, hi, this is Nathan from NIMHD. We don't ask any questions about that type of status.
Great, thank you. Let's see. Question of, are there constraints on what kinds of institutions are eligible for awards that involve U01 funding beyond those described in the FOA? No, all of those restrictions are all described in the FOAs. They differ between the two FOAs, so take a careful look at those, but the restrictions are all outlined there. Let's see. Can a co-investigator be from a non-minority serving institution if partnered with a minority serving institution on the RFA-RM-22? So for that funding opportunity, as we stated during the webinar, the applicant institution that the PI needs to be from an eligible institution. That needs to be the applicant institution needs to meet the criteria that are listed in the RFA. And the same goes if there are multi-PIs from different institutions, all of those institutions must be eligible. Now, PIs from non-eligible institutions can partner with an eligible entity, not as a PI, but as a collaborator on an application. However, in keeping with the intent of the RFA, the expectation is that the research be directed by the principal investigator or principal investigators at the minority serving institution. So the bulk of the research direction should come from the eligible institution. Question, can we offer a small grants program within the U01? So that's an interesting question. I'm guessing this is not speaking to the small budget of the proposed project, which any size budget would be allowed, just to clarify. So a small budget for the proposed project would be allowed. But I think this question is asking if part of the intervention could be a grants program as part of their project. And I believe the answer to that is if scientifically justified, it would be allowed, but I do want to make sure with Dee Dee that sounds right to her.
It does in generality. I would have to really know the specifics of the study design and the scope of work to be able to make a ruling on that definitively. So we'd have to handle that on a one-off and just contact us directly with your specific situation.
Thank you. That's very helpful. See. There's a really tight time frame for both the letter and the application. Is there any reason for only a month to prepare an application? So we've gotten variations of that question a couple of different times, so I think that's important. We released these RFAs at the end of March. There's approximately 2 months before the release of the RFAs and when the applications are due. And we do acknowledge that is a very fast turnaround time. And we thank the applicant community for being accommodating and flexible. That is part of the reason also for our desire to reissue the funding opportunity for the minority serving institutions, recognizing that institutions that are targeted by that funding opportunity may be at a particular disadvantage in turning around an application very quickly. If they're at an institution that, as per the eligibility criteria, doesn't hold a lot of NIH grant funding already, and might not be as familiar with the NIH grants process. So it is a short timeline. We did really feel strongly about launching this initiative to get some concrete and really innovative, transformative research projects started in fiscal year 21. I would also encourage everyone to be paying attention to NIH more broadly. There's a lot of interest in health disparities research, particularly now. There's a lot of activity at NIH. I'm sure many of you have already seen funding opportunities that have been announced in this space. And so I think that, please also be paying attention for opportunities that might align with your research. If this is a very tight time frame, we certainly won't be able to accommodate all of the great ideas that we're going to get, but I think there will be lots of other opportunities out there. So everyone should please be thinking of that as well. Let's see.
Stephanie, I'm sorry to break your focus. I know you're looking for a good question. You want to talk about how many applications will be awarded or expected to be funded?
That's a great question. So as we kind of described in the webinar, in the RFAs, we have said that we anticipate approximately 10 awards per RFA. So that would be a total of 20. However, because the application budgets can vary so significantly, that will really depend on the size and scope of the most meritorious applications that we receive. So I would say, you know, that number of 10 per RFA is fairly general. It's an estimation, but it's not a guarantee. So I know that's in some ways might not be, it's not very definitive, but with the flexible budgets, it's a little bit harder to predict exactly how many awards. 10 per RFA is our best estimate. We've gotten a question about what about underrepresented minority PIs at majority institutions? So I think this probably refers to the eligibility of applying for these awards. So we encourage, we encourage PIs from all backgrounds. We encourage diverse perspectives. We think that that brings a lot of value to the research enterprise. It creates better science if we have diverse perspectives. So we would definitely encourage underrepresented PIs or PIs from underrepresented groups, but who are at a majority institution that does not meet the eligibility criteria for the RFA that targets minority serving institutions, to please consider applying under the other RFA. We've gotten a few questions about what is the other RFA that we're talking about. So just to reiterate, there are two RFAs. There's one that's focused on minority serving institutions. That is RFA-RM-21-022. There's an RFA that is more has a broader eligibility, that's kind of a more wide open to almost all comers, and that is RFA-RM-21-021. So if you don't meet the criteria for the minority serving institution one, please do consider the other RFA. Could interventions include changing the perspectives of scientists and their research study design in translational research that could impact a population more broadly, as opposed to a particular patient group? So the impacts of the proposed intervention could be as broad as the proposal envisions it, right? So the proposed intervention could propose to impact very broadly populations, a significant number of populations that are experiencing health disparities as listed in the funding opportunity. It doesn't need to be limited to one. Now, do keep in mind, though, these interventions are meant to address health disparities. And so when thinking about the proposal, you want to think about, will this intervention result in impacts on health disparities and health inequities that can be measured in the time frame of this award? Can we look at this intervention and see impacts on health of these populations? Can we show that within the time frame of award? Someone's asked, again, I think this gets back to the eligibility. Can you define or operationalize minority serving institutions? Yes, so that is defined in the RFA under the eligibility criteria. So the eligibility criteria for RFA-RM-21-022, that is how we are defining minority serving institutions for that RFA. So look to the RFA and the eligibility criteria to understand this is the definition of the institutions that are eligible. So we've gotten, let's see. Okay, so we've gotten actually some follow-up questions about the answer regarding undocumented persons. And so I just to summarize, I think the answer was that NIH does not ask about documentation status. That is not something that is required information to provide. So for example, if you are, if your intervention targets a population that is listed in the funding opportunity, as a population experiencing health disparities, and that population also has significant numbers of undocumented persons within it, that would meet the criteria as long as it is part of one of the populations that are in the funding opportunity. Now, we've gotten another question about whether undocumented persons themselves is that considered a health disparities population? So again, I'll turn that over to Nate, our expert on the definitions. Can you speak to that? We're coming close to the end of our time, so I'm not sure if Nate is still available.
Can I just add something to the undocumented allowability?
Yes, please.
I think it's important, while NIH does not collect this information or request this information, your university or institution might have policies regarding that, and you should check with them as well.
Great, thank you. That's very important to know. So I would say too that the populations that are considered within this NIH designated definition of health disparities populations, those are listed in the funding opportunity. So do look there. Those are the defined populations, and consider whether the population you are targeting with your intervention is included within that list. That's really the best way to know how if your population is included within the scope of this RFA. And we've actually gotten a number of questions that sort of all can be summed up of, is my population eligible? So I'll just refer people back to the RFA for that. Okay, and the question about when will the panel meet and when will we know a score? So as we went through in the webinar, the panel will meet at the end of July. Perhaps Aruna or Shalonda can give more information about exactly when the scores will be provided.
Sure, Stephanie. We are thinking that the panel will convene sometime around July 27th and 28th. So 3 days after the meeting, you will receive your overall impact score. And within 30 days of the meeting date, you will receive your summary statement. So 3 days, you'll receive your score. You'll know if the application was not discussed or in the impact score received if discussed, and your written summary about 30 days after the meeting. And so, once we get the applications in and finalize a meeting date, we will send an email to all PIs indicating kind of the meeting date and what to expect thereafter.
Great, thank you so much. Is it appropriate to have an early investigator as a PI? So that would really be a judgment call based on looking at the criteria for the investigator in the RFA and deciding if an early investigator would meet those criteria and qualifications. And so, you know, you'll want to think about if this person has all of the qualifications and experience and the background needed to be competitive, then that might be a good choice. We did try to tailor, as we mentioned earlier, tailoring some of the investigator criteria to allow for some of the unique contributions that researchers working in the health disparities sphere may have contributed significantly to public health and to community organizations in ways that are not readily captured by sort of standard metrics of productivity like publications. And so we do have that tailored review criteria to hopefully encourage the reviewers will be thinking about sort of the different ways that you can measure productivity specific for this area of research. Okay, please provide more details regarding strategy outlines and differences with the regular R. Danielle, maybe we could flip back actually to that slide. I think it's a little further down where we have the table.
Okay, I was gonna say, if you remember the slide.
Right there. Oh, yeah, that one.
Okay.
So this really highlights at a sort of a high level some of the differences between our RFA, the RFAs we're discussing here today, and the standard research application form. Please do, though, these are the highlights, so please also look at the entire FOA or the entire RFAs for all of the guidelines. But really the intention of these unique aspects of the application are to focus the applicants and the reviewers more on the potential for transformative impact and the innovative nature of the proposal, rather than detailed experimental plans and preliminary data. So this is really, think of this as your vehicle to communicate your vision to the reviewers, why it's exciting to you, why you really feel that this proposed project has the potential for really significant and important impact. Thinking at a sort of higher level, communicating your vision, I think might help frame these applications, because it's really more about the idea and the potential for impact rather than demonstrating to the reviewers that this is the next feasible or safe step in the research progress. This is really about big, bold ideas. So looking carefully at these instructions, it outlines all of the differences between this application and a standard research application. Please follow the instructions carefully. Do provide things as they're described in the RFA. Make sure you're following all those instructions, and that should give, I think, a pretty clear picture of what needs to be different, how this is different. So let's see, we're coming close to the end of our time. I would just like to reiterate again that if your question was not able to be answered today, we do have a lot remaining in the Q&A box. If you were not able to have your question answered today, please do send it to our mailbox. Danielle, if you could go to the last slide just to remind people of that email address. We are receiving a large number of inquiries, so we ask your patience. We'll get back to you just as soon as you can. In the meantime, we have a frequently asked questions page for these initiatives. That's very helpful. We do ask that you look there. We'll be updating those after the webinar. And please do read through the RFAs carefully. There's a lot of good information there that might help answer some of your questions. I just want to make sure everybody has our, we don't have it visible, but just to make sure that everybody has the frequently asked questions link. Let's see, I think I can put that in the chat box and that should go to everyone. So let's see. I'm going to send a chat to all of our attendees with a link to our frequently asked questions. And so that is a really great resource. You'll also see a number of other web pages related to this initiative that will be very helpful for you. So please do check out those resources. And we will also be responding to questions just as soon as we can. Thank you everyone for joining us today. That we had a terrific turnout. I'm so glad everyone is very excited about these RFAs. We're looking forward to supporting really great science, and best of luck to everyone. Good luck with all your research and the important work that you're doing. Thank you all.